Some of the common knee injuries that we see are knee sprains, MCLs and ACLs and LCLs, meniscus tears, surgical reconstructions, and sometimes the total knee replacements, which is very common these days. And then we'll see your normal patella issues, tracking problems, usually due to some of the muscle imbalances that we commonly find.
They could be traumatic, they could be just a chronic issue, an overuse issue, someone who's a runner, sometimes ends up with these inflammatory conditions that need to be treated.
Surprisingly, most injuries that we see are non-traumatic, which means they're a result of muscle imbalances, dysfunctions. Usually we see dysfunctions at the hip and also at the ankle, which cause the knee to actually take the abuse.
Your whole body really is a big chain that's connected in several ways, and we need to kind of figure out the deficits within that chain to really truly address that.
What we do as physical therapists is to evaluate and detect muscle imbalances that create a person's pain.
And what we're trained to do is assess those problems, those dysfunctions, and come up with the program that's right for them.
One of the common surgeries that we see these days is a total knee replacement.
About 600,000 of these surgeries are performed every year in the United States alone.
Very commonly in a knee replacement, one of the hardest things is restoring their range of motion because of scar tissue, because of muscle guarding.
We really want to work on getting that range of motion back as quickly as we can before a lot of scar tissue builds in. So we do a lot of manual therapy. There's a lot of stretching and really education of the patient, teaching them how to stretch and maintain this range of motion on their own.
And then it's ultimately about regaining their strength. And we have a very thorough exercise library that we use to restore their function, to restore their strength. Active, isolated exercises, progressive resistance exercises, as well as functional exercise, such as squats or step-ups.
Our goal is to get them back to doing the things that they love to do, whether it be sports, whether it be running, whether it be walking, whether it be picking up their grandkid, just to have people not live in pain anymore and have the strength to get through their day and do the things they like to do with minimal to no discomfort. Then we know we've done our job.